case to your attention because it's representative of very many similar cases where we have an aged person, probably approaching end of life, being cared for, either at home or in a care home. Now, this case has been brought to our attention by a carer looking after a woman who's 94 years old. And this is what she writes about the patient. She says, the patient seems to take great pleasure in hurting other people psychologically, and she smirks when she's doing it. She seems to be oscillating between two psychological states, dominant and submissive. She has no kindness or empathy or concern for the well-being of her own children or others caring for her. She has no obvious cognitive deterioration. Her husband died 5 years ago, and since then she's been in a rage, which was worse then, but has diminished somewhat, but she still resents her children and carers. So cases like this do represent a challenge for carers and family when they're trying to care for their aged loved ones in the end of life. So we investigated to see this case to see if there was any external influence, and I'm now going to share with you the recording of the intervention and the follow-up we received 3 days later. Listening to this, I'm speaking with our medium Andrew, and he has his spirit guide Chen with him. Andy and Chen, this is for a 94-year-old lady in a care home. So can I ask Chen, do you have sufficient information to connect with this client, Chen?
Okay, yeah, so we're connected.
Can we have a sovereignty check? How's her sovereignty look?
Okay, so that fails on the third test.
Okay.
So there are 2 small grade 1 negative entities connected, so we'll clear and remove those.
Thank you. And for the benefit of the client listening to this, these are minor troublesome ones, but they do cause a lot of trouble.
Okay, so there's no grounding or plate in place at all, so we put grounding down.
Right. Thank you.
And then we'll take a look into the inner etheric.
And this needs to be clear and bright and white, and if it isn't, Chen is going to tell us what's there.
Okay, yeah, so it's dark grey, basically there's a lot of stale, stagnant energy in that inner etheric, so we'll clear that out.
Thank you. Anything else?
So heart chakra is split into 2, so we'll repair that. Okay, the spiritual essence isn't in phase with the physicality.
Right, now that's important. That's interesting. So the spirit is out of sync with the physical. And this is, I'm speaking to the client now through the recording, this is usually due to some kind of out-of-body experience, quite often anaesthetic operation or astral travelling. Perhaps Chen can put his finger on the cause of this for the benefit of understanding?
Yeah, he's saying some sort of medical procedure.
Medical procedure, okay.
So probably anaesthetic.
Right. And is that being corrected now?
Yeah, it's been done.
Excellent, thank you. That will make a lot of difference to how she feels.
Okay, so there's no curses.
Right.
There's no portals.
No portals. What about interdimensional parasites?
Yeah, okay, so there's a small group of those to clear and remove.
Thank you.
And also the chakras are all being reopened, so the majority are closed. Okay, there's also 3 earthbounds connected. So I'll open a doorway to spirit, call forward someone that's happy to take them through, they're happy to go through with.
Thank you very much. Right, let's have a look at the aura now and see how intact it is. What's the integrity of the aura on a percentage?
Okay, so that's 65%. Yeah, Chen's just saying it's mainly due to degradation, obviously down to health conditions.
And
I assume medication as well?
Yeah.
Okay, can it be improved upon?
Yeah, okay, so they're going to try and strengthen that for her.
Thank you very much. And to what extent is the soul essence within the body connected with the higher self?
78%.
That's not too bad, is it?
I'd say, yeah, probably quite good actually.
Okay. The client asking on behalf of this lady has suggested that she has challenging behaviour. Can Chen give us any principal cause of that?
Chen's just saying it's basically just down to the emotional state of the subconscious effectively, but he's saying obviously it's been manipulated by the negative entities and also the earthbound's connected.
So the manipulation from external forces have impacted on her behaviour. Yeah.
He's also saying there's also elements of dementia and other types of mental issues around that faculty.
Okay. Now I need to put into the database a principal cause of this lady's distress. What would we put it down to?
Chen would just say basically, well, he would call it age-related, but effectively,
okay.
The etheric perforation.
And hopefully we'll see a change in her demeanour since the removal of these negative influences, yeah?
Yep, yeah.
Okay. Any advice for her carer?
I mean, Chen's just saying just to be sympathetic and loving, really.
Okay. Right.
So he's saying that there's obviously a lot of manipulation that's happened or gone on, but then most people at the end of their life end up in that state anyway, especially if they've got dementia problems.
Okay, fine. Well, thank you very much, gentlemen. I shall finish the recording there now. Thanks a lot. Thank you.
This is the feedback following 3 days after the intervention from the carer. The patient is now a different woman. She makes eye contact now, which she didn't do before, and she says kind things such as, my dream is to feel peace before I go. The anger has dissipated and now she feels more subtle feelings, including sadness. And where she said, my dream is to feel peace before I go. This is something she would never have said before. Her family and I am amazed. So this illustrates, for me, an example of where these techniques have value in care homes and in caring for the aged. So if you are a carer and you are dealing with patients who are presenting challenging behaviour, perhaps this is something you'd like to learn how to do.